Let's talk about the medical causes of a sexless marriage. When try harder is actually the wrong advice. If sex hurts, erections fail, orgasms disappear, or desire crashes, that is not a moral issue or maybe a commitment issue. It may be a medical issue. So let's talk about this with openness and care as usual. I am Dr. Tangie, the sex doctor, board certified clinical sexologist, and on a mission to destigmatize sex and elevate sexual health conversations like they deserve. Welcome to my channel. If you are new to my channel, I am so happy you found us. Please join this vibrant sex positive community. We need you. We want you. By subscribing. Your subscription does not take any of your time, does not cost you anything, but that gesture helps the algorithm prioritize my content instead of hiding it. And it helps this channel be found and grow to reach a wider audience. To find other ways to support this channel, go to the description section of this video and click on the icons that appear on this video. So don't be shy. There's no shame in being curious and learning about sex. And we all deserve access to sex information. So do it with me right now. Find that subscribe button and click on it. Thanks. So this is the biggest mistake couples make. They personalize a body problem. They internalize like, you don't want me, you're not attracted to me anymore, you're selfish. But sometimes that's not true. Sometimes your body's saying, I just can't. There are common medical contributors in men for sexlessness in relationships. Erectile dysfunction is at the top of it. The vascular, hormonal, or neurological causes for erectile dysfunction, diabetes, metabolic syndrome, high blood pressure, and some medications, low testosterone, sleep apnea and sleep problems, depression, anxiety, alcohol overuse, pelvic floor dysfunction, sometimes conditioning to patterns that are not realistic in relationships. And the key point is that ED is often a vascular signal before bigger problems appear. So get that checked. And some common medical contributors in women are pain with sex, like vaginal dryness, pelvic floor dysfunction, endometriosis, vulvar pain, perimenopause, and menopause that cause estrogen drops and irritation and reduced arousal, postpartum changes, the decrease in testosterone, thyroid issues, depression, anxiety, medications also like SSRIs, just like in men, body image and trauma history, and the shame becomes a trap. People avoid care because they think, I should be able to do this naturally. Like my body should be able to respond naturally to sex. And for many people, this is embarrassing. It means that like something is wrong with you and that's how you interpret it. But no, it means that you're human, that yes, sex is a healthy function and you're not functioning like a healthy individual at that point. So let's work on some plan to get this addressed. First, medical evaluation, labs, a medical review, an evaluation with a plan, a low pressure intimacy rebuild with connection and touch, and targeted treatment like pelvic floor therapy, hormone support, ED treatments, and follow up with your health, with your metabolic health. What do you say to your partner if you're in this situation? I miss you. I want us. There may be a health issue involved and I want to address it together. Can we approach this as a team? And that's a loving approach. That's sexy. That's safe. But you have to be able to talk about this. When you become two in a relationship, it should be a given that you can talk about everything, that you can be transparent, that you can be honest. If you cannot be honest with your partner for fear of rejection, then you need to have a very different conversation also happening on the sidelines. If you have a medical issue that is preventing you from accessing the sex life that you want, you owe it to yourself and you owe it to the other person to address it. Some questions for you. Have you ever avoided sex because of pain, anxiety, or body changes, or because erections became unreliable? What's one symptom you wish people would stop shaming and start treating? I know I have a lot, but leave your comments below. I want to know, and I read all the comments. Please, if you're in a sexless marriage that is caused by a medical issue, there is help for you, and you don't have to struggle. Suffering is optional. This is Dr. Tangie, the sex doctor, and as always, I wish you safe, healthy, and pleasurable sex of whatever kind you practice. See you next time.